Good evening. Thanks for always staying with Lagos Television. You are watching Sound Health. I am Olasumbo Modupe. Diabetes is a chronic non-communicable disease that results in too much of sugar in the blood. According to the World Health Organization, over 537 million persons are living with this condition. Today on the program, we are taking a look at how to manage diabetes in persons. Stay with us. The conversation begins after this break. It is still Sound Health on Lagos Television. Joining us via Zoom this evening is Professor Olufemi Fasanmade, President, Endocrinology and Metabolism Society of Nigeria. He is also a consultant endocrinologist with Lagos University Teaching Hospital. Good evening, Professor Fasanmade, and thanks for joining us.
Good evening. Thank you for having me on your program.
Okay, Professor Fasanmade, diabetes is a non-communicable disease, a chronic one for that matter. Let us know what causes diabetes in people.
Yes, thank you very much. Diabetes mellitus is a non-communicable disease, which means that it is not infectious. And there are several factors that lead to the development of diabetes. You don't have one single causative factor. It's not like malaria that you say malaria is due to malaria parasite. With diabetes, what we have is multiple factors. Some of these factors are hereditary, and then some of them are acquired, meaning that things that we do to bring it on ourselves. In the hereditary aspect, a person that has both parents, for instance, who have diabetes, he himself now has a high risk of diabetes. Or if there are identical twins and one of them has diabetes, the other twin, if he has not already developed diabetes, is at a very, very high risk of diabetes. So in that form, we will say that it is mainly hereditary factors. But there are also other things that are environmental or acquired. For instance, our habits. If we don't exercise sufficiently, if we eat a lot of junk food, if we put on excessive weight, if we drink a lot of alcohol and smoke, all these increase the odds for that person developing diabetes. Also, if you are not having adequate rest, adequate exercise, a healthy diet comprising plenty of vegetables, cereals, nuts, if you are doing the opposite of that, meaning you are taking too much of fast food, too much of pastries, too much of refined sugar or refined carbohydrates, that person is at great risk of developing diabetes mellitus.
All right, Professor Fasanmade, are there signs to tell one is actually experiencing this condition?
Unfortunately, many people that have diabetes do not have any feature, which means it is silent. And those are the majority of people. And that is why we always advocate that every adult should from time to time check his blood sugars. The same way we like to check our blood pressure or check our eyes, we should check our blood sugars, because many people that have diabetes have no symptom and have no sign. In fact, by the time we are seeing signs or symptoms, quite a number of times it is already getting complicated. And those symptoms that the people do have is they pass plenty of urine, they are very, very thirsty, they drink plenty of water, they start to lose weight, vision may become blurred, and the person may have other things like poorly healing wounds, recurrent boils or infections over different parts of the body. And then some people, especially the ladies, if they're in the reproductive age group, may notice that they're having recurrent miscarriages. So you can see that these symptoms or features, they are usually features that occur in people who have had the disease or are already getting complicated. So those are some of the features that these type of patients have. By the time most people are already getting very thirsty, they are drinking plenty water, that may be the sign of a complication of diabetes. They might be almost going into coma at that time, which is why we tell people, do not depend on you seeing or feeling something before you know you have diabetes.
Oftentimes you hear people say, I'm living with type 1 diabetes, I'm living with type 2. What types are common in this part of the country, in this part of the world, and how do you tell you have type 1, type 2? At what stage do you need to know?
Yes, there are different types of diabetes. Type 1 diabetes is not common. We used to call type 1 diabetes insulin-dependent diabetes. We also used to call it juvenile onset diabetes. So this tells you two of the characteristics of this type 1 diabetes. It occurs in younger people, and usually people that have type 1 diabetes require insulin for their day-to-day survival, which means they cannot do more than a day or two without insulin. If they go longer than that, many of them will find themselves in the emergency room of the hospital. So it appears more dramatic, it appears more severe, and it occurs in younger people, and it requires insulin for the treatment. On the other hand, type 2 diabetes is the commonest one that you see worldwide, even in Nigeria. And we see that somewhere between 95 to 98% of people that have diabetes in Nigeria actually have type 2 diabetes. Type 2 diabetes occurs in older people, usually, but it can occur at any age. Type 2 diabetes could be treated with or without insulin. And then type 2 diabetes, usually the presentation is less dramatic. Usually people with type 2 diabetes may not know they have the condition for several months or years. Unlike type 1 diabetes, when the person develops it, he knows he has something because he falls ill almost immediately, unlike type 2 diabetes. There's still one more type of diabetes, which is called gestational diabetes. The word gestation just means pregnancy. So that is pregnancy-induced diabetes. In this type of people, before pregnancy, their blood sugars are normal. They get pregnant, the blood sugars go up, and then they give birth to a baby or have a miscarriage. After that, the blood sugar is normal again. So we call it gestational diabetes. So these are the three main types of diabetes, but just remember that 95 to 98% of people that we see with diabetes in Nigeria and many parts of the world are actually type 2.
All right. In your response, you mentioned that we now see more children coming up with type 1 diabetes. Could this be hereditary, and why are we seeing this development in children?
Yes, usually when diabetes occurs in children, decades ago, it was almost always type 1 diabetes. But nowadays, we are seeing children developing type 2 diabetes. And the reason for this increase in the number of children developing this type of diabetes is because, first of all, hereditary factors. Some of these children have parents that have diabetes. And secondly, many of these children are doing the things that lead to diabetes in the older people. They are putting on a lot of weight. They are consuming a lot of sugar-sweetened beverages. So the major driver of this type of diabetes in children is childhood obesity. Type 2 diabetes is quite common in people that are overweight and obese. And if you look at children in school today, they are much fatter, much bigger than children in school 20, 30 years ago. So that is why we are seeing this increase in number of children with diabetes, especially type 2 diabetes in children.
All right. The World Health Organization says over 500 million persons are living with this condition, but more persons are also coming up with the condition in low and middle income countries. What could be responsible for this? Could it be socioeconomic status or climate change and all that? What could be responsible?
There are several factors that are leading to increased number of people with diabetes in these these LMIC countries you have mentioned, which we used to call developing countries. And the reason is one, first of all, the population in these continents or countries have started to increase. The risk of diabetes gets higher and higher the more you age. And we do know that life expectancy in countries like Nigeria used to be in the 40s. Now we are moving to 50s, and some of these developing countries, life expectancy is getting to 60, 70. So the a major cause is the aging of the population. A second factor also is westernization. Several decades ago, it wasn't common to see an overweight or an obese person because people were doing a lot of physical activity. Now, with westernization, there is less mobility. People don't need to trek many kilometers to their farm or to school or to their office. You just order a ride on your phone and the vehicle comes right to your doorstep and drops you at your doorstep. You get to your building, your office, you don't need to climb the stairs, an elevator takes you. So a lot of it is related to westernization. And because of the easy access to quick transportation, there's also an easy access to fast food. You don't need to go out of your office before you have a fast food delivered to you. You just go to your phone, you click on it, and before you know it, in 30 minutes, 1 hour, food has been brought to you. And usually this is food that is rich in refined carbohydrates, excessive calories, a lot of frying and oil, and all of these tend to make people develop obesity, which is a major driver of type 2 diabetes. So it's not so much of climate change, it is more of westernization and aging of the population.
We hear a lot of time that it is not treatable. How do we manage this condition, diabetes, and are there complications? How do you also manage complications arising from this condition?
Yes, thank you. A lot of the non-communicable diseases do not have a cure. That is the major difference between a communicable disease and a non-communicable disease. The NCDs, what we do with them is that we manage them. So anybody who has developed diabetes, there is no cure to take it away. 99% of them is lifelong. And by managing, we mean you use lifestyle, diet and medication to bring your blood sugars to normal level that is similar to people that do not have diabetes. If you do that, complications will be few and they'll be far between, or you won't even have any complication at all for many years. So you manage the diabetes, and that involves a healthy diet as prescribed by your doctor and implemented by your dietitian or nutritionist, adequate physical activity, walking around, doing between 8 to 12,000 steps a day, or exercising 3 to 4 times a week, and then keeping to the medications that your doctor has prescribed for you to take. These are what we do in the management of diabetes. So you are a manager, you handle the condition, which is lifelong.
Okay, this year's theme for World Diabetes Day is access to diabetes care. How well do you think we can educate, enlighten, and increase the awareness about this disease?
Yes, when we are talking about access to diabetes care, we are saying the person with diabetes should be able to see a doctor or a healthcare professional that will help him in managing his condition. And the patient should also be able to have the ability to get the appropriate medication and to treat himself and to monitor himself. So we have a dearth of care professionals. There are fewer and fewer, especially with the brain drain. So that itself is against access, because when there are less doctors, it means the patient needs to wait longer for an appointment, or it may even be difficult for them to lay their hands on somebody who can manage their condition. But to improve the access, we need to train more healthcare professionals. More people need to be empowered in the management of diabetes and educated to be able to manage the people with diabetes. It's not only doctors that are required, nurses are required, community physicians are required, community physicians, community pharmacists, nutritionists, dietitians, diabetes educators. There are many people who share this burden of managing the people with diabetes. But the most important person in the management of diabetes is the patient himself or herself. Because even if you go to a doctor's office to have a consultation, at most you will spend 10, 15 minutes there, but you are with yourself all the time. So patient empowerment is very, very important in improving access, meaning that we train the person with diabetes to know how to manage himself when the doctor is not available. And in an ideal situation, a person with diabetes checks his blood sugar, takes his medication, does his exercise, eats healthy, and then monitors the sugar level, the blood pressure, and other parameters to determine that, yes, I am doing well, or I need to do more, or I need to see my doctor or the person managing my condition.
Talking about eating healthy now, you hear people say, I cannot take carbohydrate, I cannot take this, I cannot take that in order to bring down my sugar level. What are the basic nutrients one should accommodate or incorporate in one's meal just to beat diabetes, to keep the blood sugar level low?
To maintain a healthy blood sugar, everybody requires a balanced diet. The person with diabetes still requires carbohydrate, but it is complex carbohydrate. So a person with diabetes must still have between 60 to 70% of his meal being carbohydrates. But again, I will say the type of carbohydrate is what matters. Complex carbohydrate, the type of carbohydrates you eat when you're in the village. You eat amala, you eat eba, you take tuwo, you take beans, you take local or father rice, complex carbohydrates. The challenge is that many people, they run away from carbohydrates completely, and then they think that by so doing they will be healthy. Carbohydrates provide fuel for us. So it is the type of carbohydrate that matters. In addition, the person needs to have some amount of fat or oil. but it's better that those fats and oils are the ones that don't cake. If you have an oil that is looking solid, such as butter, that is not a healthy type of oil. An oil that is liquid at room temperature, vegetable oil. And even while you are doing that oil, make sure you don't soak the food in oil. Let the oil or fat be moderate, and preferably vegetable rather than animal fat. Then the third one is protein. Because you need to maintain your body structure, you require to be on an adequate protein intake. So you must eat protein. So in summary, when you talk about healthy diet, just imagine when you go to greet your grandmother in the village or grandfather and they prepare a sumptuous meal for you. That is what a healthy diet looks like. Plenty vegetables, some amount of meat or fish, and then complex carbohydrates in form of your eba, your amala, your acha, your tuwo, or your local rice.
Eating healthy, lots of exercise, and adhering strictly to all measures or advice by your private health practitioner will do a lot of good for you to keep your blood sugar level low. Professor Olufemi Fasanmade, thank you so much for your time and expertise on the program. We really appreciate you.
Thank you for having me.
I have been speaking with Professor Olufemi Fasanmade, President, Endocrinology and Metabolism Society of Nigeria and Consultant Endocrinologist, Lagos University Teaching Hospital, on managing diabetes. Sound Health continues with trending health report from around the world. Please stay tuned. It is still Sound Health on Lagos Television. More to come in a moment. Sound Health on Lagos Television. This is where we say thank you on today's episode of Sound Health. Remember, scaling up of diabetes education will do a lot of good in managing this condition in persons. Keep your blood sugar level low, increase your exercise, and eat healthy diet. And for comments and inquiries, please send SMS to 0035826603 or follow us on social media at LTV Social, #Sound Health. A sound health is a sound mind. Make healthy living your choice.